Sonia Kumar, who's joining us from the BodyBrave Eating Disorders team, which I know this program is based in Ontario, but I know it's a collaboration with Eating Disorders Nova Scotia. So we're looking forward to hearing more. Over to you, Sonia.
Thanks, everyone, and a huge thanks to CFHI. So just a quick heads up that unfortunately wasn't able to get in our slides on time because we're a very small team and we're dealing with about quadruple in demand from individuals across Canada. So we are a bit overworked. So my apologies for that, but please don't hesitate to reach out if you have any questions. So I'd like to start off by talking a little bit about eating disorders just briefly because not many people know much about the condition. They are complex, biologically driven, very serious illnesses with the highest fatality rate of any mental illness. So prior to COVID, about 7.8% of the global population is impacted by an eating disorder, and only about 10% of those people receive specialized treatment. So gaps are anything from barriers to access, economic disparities, limited treatment options, and then that's all compounded by stigma and shame. So, in Canada, there's very little in the way of options for individuals. Often people have to be very sick in order to access care. And then in terms of after COVID, of course, a lot of the hospital treatments shut down or they reduce their capacity. So we're facing a real crisis right now across the country, really. A lot of those treatment programs are actually still closed or still at reduced capacity. The good news is with early intervention and rapid access to treatment, about 75% of people with eating disorders do recover. So if we can really get that number up, and if we can reach out on time, then people do recover from these issues. And as a side note, that eating disorders also impact families, they impact communities. I mean, it is a really large issue, and those of us who work in the sector consider it very much a public health crisis. So some of the problems we're dealing with, as I mentioned, was barriers to treatment, and also a lot of the organizations that are really on the front lines are small community organizations, nonprofits who have very few resources to work with. So we wanted to develop a person-centered virtual solution that provided accessible treatment and support by peer support workers as well as clinicians to clients who are struggling with eating disorders across the country. So we got together with a few different organizations, one in Saskatchewan, of course, in the lead is EDNS, Eating Disorders Nova Scotia, as well as BodyBrave, as well as the National Initiative for Eating Disorders. And we started work on a virtual social learning platform that was designed by and for organizations across Canada that support individuals impacted by eating disorders. And I want to mention that this model is scalable for any mental health issue, but it was designed for those organizations that have very few resources. We don't have the time, we don't have the money to really have that proper tech support. We don't have staff that we need to spend 2 weeks training. It's not possible. We need to turn around within, say, 2 days. So given that, we created this social learning platform. So on this platform, individuals can access education modules, peer support groups, workshops, as well as treatment, which is all delivered by these community organizations. So when the pandemic hit, many of us had to switch virtual, as I know many of you have had to do that as well. So we wanted a way to quickly disseminate things like handouts. We also needed a way for people who are sitting on a wait list to access materials, learn a bit about our programs. We know from the research that for folks sitting on a wait list, it can be very detrimental just to sit there and not have anything to do. We also have features like live classrooms, discussion forums. There's opportunities for individuals to not only connect with each other, but also facilitators. So it's really a community space. It's a knowledge hub and a service delivery tool. In terms of our outcomes, we measured everything using Google Analytics as well as some patient feedback forms. All of it was presented live on a Google dashboard, and it still is. So we were able to increase access to those handouts, increase access to care, reduce our wait times. Some of our statistics were that 60% of users completed an entire course or program. which means they went through each step of an online course. Just to, as a sort of context, the study conducted by Harvard showed that average course completion rates are about 46%. So 63% is pretty good. One of our biggest things that we were really proud of is that Bridgepoint Center for Eating Disorders in Saskatchewan, their residential treatment program, they had to shut their doors completely, but thanks to the EduE platform, they were able to put everything online and actually open up again and start offering services. So currently we have 270 participants registered and about 66 courses on the platform, and we're planning to keep on scaling it as much as possible. Thanks so much.